Welcome back to my mini series where I talk about women's health issues, pregnancy issues, conditions, whatever it may be. This is part 3 of cholestasis of pregnancy. We're going to talk about induction, when we recommend induction, delivery, and do we do anything postpartum? So yes, for most patients that have cholestasis, we recommend induction, but when we make that recommendation is going to depend on the level of bile acids. To remember from my other video, you know that we make the diagnosis based on liver function and level of bile acids. In that other video, you know that one of the risks of cholestasis is preterm birth and stillbirth. We know that there's a direct correlation with the higher the level of bile acids are, the higher the rate of stillbirth that we see. So if your bile acids are really high, we may recommend induction earlier or delivery earlier, sometimes even as early as 36 weeks. Because again, the higher the bile acid, the riskier it is to the baby. So I expect your doctor to talk to you about when is the best time to induce, again, dependent on your bile acid level. Also, it's going to depend on your monitoring, right? As I mentioned in the last video, we're going to do close monitoring of you and the baby. If we see a baby that's worsening, we're probably going to deliver earlier, even if the bile acids have remained steady, because clearly, clinically, something's off. And stillbirth is too big of a risk to just sit and wait. It's just going to depend. There's no hard rule that says everyone has to deliver at 36 weeks or 37. It just is going to depend patient to patient. What does that induction look like? Again, this is just going to be like a normal induction, whether that's with the Foley balloon, with misoprostol, with Cervidil, with Pitocin, with just breaking your bag of water, all the other induction methods that we have. It just depends. But again, this does not mean that you have to have a C-section because of cholestasis, because I've heard that before, and that's a lie. What do we do postpartum? As I mentioned in my previous video, most of the patients with cholestasis, their symptoms of severe itching go away a couple days after delivery. Their bile acids go back down to the normal level a couple days after delivery. It truly is a condition, a liver condition, that is isolated and seen only in pregnancy. Do we need to continue the medication? Do we need to do weekly blood work after delivery? Do we need to do something? No. That is the end of my first part of my mini series. I hope you guys learned something new. Stay educated, stay empowered. I love you guys. Let me know in the comments what topics I should cover next. It can be anything pregnancy, women's health, gynecologic, whatever. Love you guys.